Welcome back to Smitty's Learning Room. Today we continue to look at the sports medicine option, and we're going to have a look at some of the considerations for adult and aged athletes. If you haven't already watched the video on children and young athletes, I would recommend watching that one before you watch this one. So let's start by having a look at the syllabus and where does this content come from in the syllabus. So we're looking at sports med, the option for HSC, and we're looking at the focus question, how does sports medicine address the demands of specific athletes? Now today, we're going to have a look at athletes such as adult and aged athletes and some of the conditions which they suffer from or prone to, such as heart conditions, fractures, bone density, flexibility and joint mobility. And we'll have a look at some of the considerations we can put in place to try and ensure that adult and aged athletes can participate in sport in a healthy and safe manner. So when we look at adult and aged athletes, sometimes people might say, oh, they're too old to participate in sport. But activity for older people can actually be beneficial if care is taken to plan their activity. And when we have a look at some of the benefits, we see that their muscles and their just general flexibility is improved, their joints are improved, or their strength of their bones, the density of their bones is improved, their flexibility, and also their heart and the way that their cardiovascular system works is improved because it's been put under a little bit of pressure and it's allowing the body to continue to use this. So obviously exercise has a lot of benefits for everybody, but in particular adult and aged athletes, we see that physical activity allows our body to continue moving, and it's kind of a case of like, if you don't use your body, you're going to lose the function of your body and deteriorate. So obviously it's a really good thing to try and promote physical activity for adult and aged athletes. We just need to be careful as to how we get them to participate in physical activity. So when we look at physical activity for adult and aged athletes, if they engage in regular, vigorous exercise, it can decrease the risk of cardiovascular disease, osteoporosis, diabetes, and cancer. Now, a lot of these issues, cardiovascular disease, diabetes, cancer, and osteoporosis, are covered in Core 1 of the HSC. So if you need to go back to the Core 1 videos to have a look at some of that content, that would be a good idea to do. Now, when we look at adult and aged athletes, coaches need to consider some guidelines for aged athletes to ensure that they're participating in a safe and healthy manner. And some of these guidelines include having a look at their medical history. So do they have a history of arthritis or osteoporosis? Do they have past heart issues? Do they have genetics in relation to looking at bone density? Do they have poor bone density in their family line? They need to have a look at the reasons for participation. So why are they actually participating in sport? Generally, adults and aged athletes won't be participating for competition as much as children and young athletes, and they're probably more likely doing it for social reasons or for fitness benefits and health benefits. This is obviously important because their training won't be based around performance gains, but will rather be based around health gains. Coaches need to consider having an extended warm-up and cool-down periods for aged and adult athletes, and this is because it takes longer for the body to warm up and cool down the older you get. It's really important for coaches to monitor and adjust the training programs for adult and aged athletes around the concept of intensity. So as I said before, we don't necessarily need to try and keep increasing intensity. It's about keeping the body moving in a healthy and safe way. We obviously need to make sure that participation is safe, so we're providing them with environments that are safe to use, equipment which is safe, just like we would with any other athletes, and we'll go into a little bit more detail later why it's so important to make sure that participation is safe for adult and aged athletes. And obviously you need to provide longer recovery periods, so a young adult or a child or young athlete may be able to do more than one training session a day or back-to-back longer training sessions, but adult and aged athletes may not be able to do this, and so therefore coaches need to consider the recovery period between training sessions or between game or physical activity periods. So when we have a look at some of the issues that adult and aged athletes face, which can actually impact their involvement in physical activity, we have three sort of issues, and we're looking at heart conditions, fractures and bone density, and flexibility and joint mobility. So these three issues we're going to have a look at in the remainder of the video. So we start by having a look at heart conditions. And now when our age increases, our heart deficiency decreases. So when we talk about our heart, the older we get, it's not as efficient at pumping blood around the body. And so therefore, because of that, some of the issues that can happen, or some of the heart conditions that can happen, are strokes, heart attacks, and high blood pressure. Now remember, you can go back to the Core 1 videos on cardiovascular disease if you're not sure what these are. Now obviously, if we have a decrease in effectiveness of our heart, we're going to have a decrease in oxygen in the blood. And so that means that it's going to be harder for us when we exercise. We know that oxygen gives us energy. So if we don't have as much oxygen in our blood, we're not going to have as much energy. As we get older, if we're not using our heart as much for rigorous exercise, this can also allow for narrowing of our vessels, which then in turn would decrease the blood flow to the rest of our body. Something else we need to take into consideration is that our lungs are less flexible because we're getting older and the tissues are not as good as what they used to be when we were younger. So therefore, we've got less oxygen intake for exercise. The next issue which adult and aged athletes are more prone to are fractures and bone density. Now, with an increase of our age, our bone density decreases, and we also have an increase of the amount of falls and trips and slips that we have. Now bones become brittle, so that's when we're talking about bone density. So therefore we start having issues like osteoporosis and arthritis. Now if we have a decrease in bone density, because our bones are brittle, we're obviously going to have an increase in the fractures that we have. Now, and because we have these falls and slips because we're not as balanced, this is obviously an issue when looking at sport and physical activity for older people. We need to make sure that we're programming for activities which are going to be safe and which are going to make people stable and not necessarily susceptible to slips and falls. Now, for adult and aged athletes, it's important to encourage weight-bearing exercise in their routine because this increases stability and bone density. And this obviously means that if we can increase their bone density and stability, we're going to increase the chance of their bones becoming brittle, so therefore decrease the chance of fractures, and with the stability, decrease their chances of falls and slips which cause these fractures. Obviously, something that really needs to be taken into account with adult and aged athletes is to avoid high contact sports because of their decreased bone density and their capacity to have fractures as a result of this. Finally, we look at flexibility and joint mobility. So with an increase of age, we have an increase of musculoskeletal deterioration. So you might see that adults, or especially older people, sort of start to droop and they're losing their posture. That's because when we increase in our age, our musculoskeletal system starts to deteriorate, and therefore obviously having a decrease of mobility. So obviously, if we increase someone's exercise, this allows them to use their body more, which increases their flexibility and their joint mobility. And so if we're engaging athletes in flexibility exercises, we're increasing their stability of their body, which obviously, if we talked about before, decreases their chances of slips and falls and fractures. And obviously increasing the flexibility of their body, so that means they can actually hold their body upright properly and allow the musculoskeletal system to do what it's functioned for, hold the body upright and to move. Now, some good flexibility exercises which adult and aged athletes usually engage in are things like yoga, dance and Pilates. So they're passive sort of movements which are allowing their body to be stretched out and allow for extra mobility within the joints. So in summary, adult and aged athletes are a very special group of athletes because we need to make sure that their physical activity meets their demands, and we need to consider the guidelines that we talked about earlier when planning physical activity for adult and aged athletes. We also need to take in consideration heart conditions, bone density and fractures, and flexibility and joint mobility when planning for increased physical health outcomes. So we can't just go and say to an adult or an aged athlete, oh, I'm going to give you this program because it worked really well with my 22-year-old marathon runner. So you need to make sure that their programs or their physical activity that they're engaging in is reflective of issues or sensitive of some of the health issues which adult and aged athletes may face.